So, Jamie Tibbetts is Assistant Deputy Minister and Chief Financial Officer of Health Canada. Not a dinosaur, whereas because he's been leading a wholesale transformation of Health Canada's finance function. That doesn't sound very dinosaur-like to me. So, Jamie, over to you. Thank you.
I need a microphone, I guess. Testing. Thank you very much. Interesting. I'm glad she ended the way she did. I did best a dinosaur, probably one of the biggest dinosaurs in accounting in the government of Canada. I'm an accountant. I apologize at the beginning here. We are very into regulations and control and all of this, but there is still a need to modernize and be efficient and effective at how we do this. It's not every day that I get a chance to speak about a 300% return on investment as well as change and improvement of things, especially as a public servant. You can sort of, I am, as I said, the senior finance guy. You can imagine the old days, which isn't that old. In Canada, it's actually still in place, of the green shaded accountant, right, with their pencil and their kilometer pages. In Canada, still, most of our government departments do transaction processing, contracting and paying of invoices with wet ink signatures. They're not done electronically. We implemented in 2011, or began to, in Health Canada, which is probably the third or fourth largest department in the government of Canada, a full electronic paperless environment in accounting. We had, prior to that, literally about 2,000 cost center managers processing transactions in the old way, and paper in a highly decentralized department. The country itself is large, so these accounting offices, I had 14 accounting offices across the country, 12 procurement offices. So part of the challenge was to reduce that down to about 2 and implement full electronic processing. So I use, and I didn't know this at the time I use a process called business processes management, which there's probably a lot better equipped people in this room and conference that can teach this subject. But what we did was we tried to take strategic vision, and bring it down to project management level. It's a huge gap. People will come up with this great idea in complex situations and not see how to make the change. And BPM was a way that is one of many practices that can do it. I've been in a session this morning about design and prototype tech, all these things, and it basically these things work. It sounds like an IT project that I did, but it wasn't. It was actually a serious change management project. We were catching up to technology of about 10 years ago. It wasn't new. It just wasn't deployed very well in the government of Canada. It still is not. Health Canada is probably the leading edge on this now. It was the bleeding edge. I think we're now leading. So if I switch to some of our solution, we call it procure to pay. It's kind of or P2P is our acronym. And it's basically a means. BPM was a means to that end, to look at how goods and services were acquired, right down to the processing level, and how they're paid via the corporate financial system, and how it's embedded, how we've embedded sort of one-time data capture as opposed to multiple data points. Ruthless standardization was my motto. In accounting, that's pretty important. Those 14 or 26 offices were doing things differently with different controls and practices that we saw, not the most efficient way of doing business. Looking for timely payments to clients and recipients of payments, easier retrieval of data, and looking at a national services model as opposed to individual ones. It did end up, and I've heard some conversations over today about downsizing. I'm going to talk a bit more about that in a second. We did reduce our workforce by 15%, which is seriously part of the return on investment. So literally we're the first department in Canada to implement this. We're now hosting 2 or 3 other departments on the solution. And so I think it's a way, I want to talk to you a little bit about, that's kind of what we did. I want to talk about sort of how we did it, and then some lessons learned. It's achieved many awards in Canada for innovation. It's as much transformation as anything, but it was the context and the environment that we were in which made it innovative in that context, and being able to do something that was so large like this. generally, as an executive, though, in your own departments or your own world where you work, you sometimes don't know where to start. Workflow is really an important way to look at your business, to get it down into the pieces, so you can start looking at how to find those efficiencies and improvements. Another significant challenge was basically the change management, which is often underestimated by people and sometimes overlooked because they just don't want to deal with it. But you must have an effective change management strategies and practices in place to support the business or the change, or you'll fail. And a lot of that's about people management, of course. It's important in the Government of Canada context to understand the environment I work in as well. It's very conservative. We've gone through Sarbanes-Oxley and all these other things that most international economies have gone through. There's a higher level of due diligence and oversight placed on us with audit, assurance, and oversight. But basically there was a reluctance to move away from wet ink signatures, what people were comfortable with. Every manager signing something they could agree, okay, he approved it or she approved it, I can now process it, and moving to an electronic world. And there was also an attitude throughout the system as, why would I be first? It's such a big change. And you know, careers aren't necessarily made on that. There's also an issue, I think, about job retention to retirement, I call it, where people don't really want to blaze any trails and take those risks. So the people before me are trying to find people around you that you can work with your idea, big or small. Let me tell a short story here. And I was in Atlanta at a conference, Atlanta in the United States, Georgia in the United States, in 2005, where I first saw, walking around a conference of 25,000 people. Like, this conference is small. I was lost. The town I live in is 8,000, so I'm lost in this world. I opened up a back office, much like this one here, or a back door, walked into a room, and there's a CFO of the Pennsylvania Hydro Company in the United States presenting his procure-to-pay solution in 2005. I'm like, wow, why aren't we doing this in Canada? So the idea came from there, and I said, you get your idea, and you got to find your timing right. So with government downsizing in Canada in 2011, I had the hook to be able to go to cabinet, to senior decision makers, with a business case that I had developed based on it. It wasn't an IT solution, although it was sold as an IT solution because people liked the idea of an IT solution. But it really was about changing how we managed accounting across a large department. But the downsizing gave me the hook. So the business processes analysis and the business case were there to support it. But there was government was looking for us to do more with less, frankly. Again, when we went through the change management part of this, we did close these accounting offices down into in two parts of Canada and went to an electronic processing. We engaged a lot of people. We engaged employees and staff. We engaged our audit committees, senior management. We consulted with what we call the Treasury Board Secretariat with cabinet. Ministers approved what we had done, what we were launching. The project team kept our regional offices and our branch managers informed as we went. We hired, to make the IT part easy, we hired a small crack team of it was SAP, if you know SAP, people to come in and do the ITs. We were quite comfortable with the IT part of it. It was the other aspects of downsizing with the heavily unionized organizations, et cetera, to follow workforce adjustment practices that we had to do. We also had to train a workforce on the new tools of 3,000. We had trained 3,000 users, much of it through web-based training. And again, the motto of ruthless standardization was was key to the to the messaging. I kept coming back to it. But people started looking at the accountant in the room as being ruthless. It didn't work very well after a while, so I softened it and changed it to relentless standardization as a journey more so than a person coming in to be evil. And in my job, I cannot lose control of my entity as I'm working on it. So I find these slogans actually fairly helpful. We use the one, transformation without disintegration. And it was basically so my boss wouldn't worry that she couldn't sign her financial statements at the end because I had lost control of everything. But it bought me a lot of space and time to be able to work on the actual projects that we needed to get done. On the ROI question, we spent $2.5 million. I think that's about 1.8 euros. In about 18 months to do the total changeover. I'm saving over $2 million Canadian a year now. So the ROI is very high. The business cases was there. I don't know if there was no appetite to do it though before the downsizing question came into play with the government of Canada wanting to take the risk of reducing its workforce. So let me jump to just quickly to 4 of the many lessons learned that there are. One I would always use is pick the right dance partners, but I think that was stolen, so I didn't put that on my list here. And I think it is an important lesson learned, though. Make sure you're partnering with people and engaging people that are like-minded that you can get things done with. But leadership is always critical, and it's not just my leadership, but the leadership above me and below me. Getting the deputy ministers and other people's buy-in was very key to this. Also part of this is, if I would have approved it and not been willing to put myself out front of it and tell people you're losing your job personally, I think I would have lost a lot of personal integrity and credibility. But I've also, when I launched it, I knew I was going to be in my job for 3 years. What I see in our system sometimes is people will announce a great change and then they'll go off to the next great idea and not see ideas through implementation. It's really important that your leader stays with it for the duration to make sure it gets there. The third one is timing, as I look at my clock timing down. Implementation, we had to implement this across 2 accounting periods, 2 fiscal year ends, which requires, we were moving people out of the organization, we were bringing new people on, training them, we were consolidating operations, as we also had to finish 2 fiscal years in that 18-month cycle. The mitigation strategies and the need for well-done project management is really important. The interdependencies of project plans and small teams that pull all the pieces together, you've got to be thinking of that. So the devil in the details, whatever you want to call it, but the timing aspects of how all this takes place was very critical. We did finish on time, on budget, by the way. The third one I would mention is training. I've already hit it a bit, but you had to get a new workforce coming in. We were expanding in 2 locations, downsizing in other locations. Most of the people in the areas I was downsizing, in Canada, a person who lives in Edmonton will not move to Winnipeg. So we basically had to retrain a new workforce. We were building up capacity and help people out of the system in places that we were closing, but so it required a heavy training of people who work in finance, but also the managers now that we've changed how they were doing process from paper-based to electronic-based. Training plan was very important. Web-based training was very helpful. The fourth area I would mention would be transition management. It's consider everybody in the change. And use the business process documentation to take a holistic view at your whole business. Although I would say, I'll cut this one short a little bit. In my experiences, you can divide your staff. I have 500 people working for me, to put it in context. You can divide your staff into 3 kind of major groups, especially in a massive change like this. Those that see this and go, yay, rah, rah, let's go for this. This makes a lot of sense, whether I'm affected or not. And they're the ones that you really want to draw from to get the excitement and get the rock moving. You're going to have another group in the middle that are going to sit on the fence. See, they want their job. They're 8 to 4 out the door folks, or whatever. They're going to be decent employees, but they're not going to be your change leaders. You're going to have another group, maybe even a third, that just will not accept it. And you should spend the energy on the first two groups, not necessarily the third, in my view. But we tend to spend a lot of effort on that third because of the workforce adjustment requirements, working in the environments we work in the heavy bureaucracies and whatnot. And it's a bit unfortunate, so let me close with just a couple quick statements on BPM. As I say, I'm not a BPM expert, I'm not selling it, but it's been documented as a very successful sort of case of BPM. And looking at BPM practices, you can look at Six Sigma, Lean, all these other things to find these types of change management processes. But the models are helpful, and draw the ones that work for you. But they cover sort of the 6 of the same points: strategic plan, what's your hook, how are you going to sell it, how are you going to get people to buy in and be able to get your decision to proceed. Your detailed business case, you need it. Consider someday you're going to go to a banker, especially if you're going to spend millions of dollars. Project planning, really important aspect of the change management. I use blueprinting and a thing called road mapping, which sort of takes the strategic plan and gets it down into something that you can show people with more concrete sort of evidence, and then take some time after it for stabilization and further improvement. Don't ever think you've finished, because you never have. And so on that, I guess BPM worked for me and may work for you. So I'll end up there. Thank you.
Thanks, Jamie. Thank you. Questions for Jamie? Any comments? I have one, if not. I was struck by something also that Nancy and Elke said earlier about the way that people expect things to be now, the way that systems in general work. So things like social media and the internet generally have effectively almost changed the way that people expect technology to integrate into every aspect of their life. What I wanted to ask to you was, did that help with your change process away from this kind of wet ink to something fully digital? Because we've seen in the UK, for instance, Government Digital Service make a lot of headway with the gov.uk project, basically because the internet has taught ministers this is the way systems should work, and they use those systems themselves in their daily lives. So ministers use Facebook and Amazon now, and they trust them. And so the UK team was able to say to the minister, we're going to make gov.uk the same way that Amazon make Amazon. And they could go, okay, that seems to work. I give it my credit card details. It never falls over. That's fine. Go for it. So that shift away from wet ink to digital, did it help in terms of the general timing around the way that those guys were using other systems in other walks of their life, do you think?
Yeah, the short answer is yes. There is also a changing demographic of people in the workforce. There's less of those and more of others. And so people are now more accepting of doing things electronically. And it's just the wave, not even the wave of the future. And we've integrated, it's now integrated with our email systems, for instance, which takes you to a portal, which we approve, transactions through a portal type approach. And then web-based training and support tools has all been part of the design. We couldn't have done that 10 years ago, in 2005 likely, when I first saw the idea in our environment. But it's been accepted, and it's the way we're working now.
And so linked to that, the question of empathy, of understanding where they were, but also, as you said, in a very unionized context. How did you talk about that with people? Did you say, essentially, it's a bit like the rest of the other systems are working now?
We weren't broken. There was nothing broken in my environment. The Treasury Board Secretary of Canada assesses financial management in every department. Health Canada was assessed as strong. This is before I made the change, and here I come out to all my accounting clerks in office and say, you've been doing a great job. We're just not doing it that way anymore. So we're driving in a whole new way of doing business. We weren't tweaking the business. We just looked at our business process and said, this doesn't make sense to automate the existing practices. We stole what was best practices in the industry, companies like IBM, elsewhere that do accounting this way, and said, thank you very much, this is how we're doing it. we had some people go, I'm affected, I'm losing my job, but that's the right thing because taxpayers are, it's going to be better for them and provide proper internal controls around spending. But why people wouldn't do this before I chose to do it, because maybe I'm a little bit crazy, but because it was a lot of work. But I think it goes back to a culture within the organization. There's also, people didn't want me doing it because I was going a little bit rogue at times, because there's a collectivity that would like to get the kudos for doing it too, but they didn't. They had spent 3 years not getting anywhere, and meanwhile I was asked to cut 10% out of my organization. The low-hanging fruit was gone. The only way to get that sort of savings was through transformation and in a new innovative way of doing our business.
Okay, a question down the front here. Here, do you want to use mine?
Okay, talking about new ways to doing business. There are a lot of people investing a lot of money in developing new apps in order to transform our cell phones and iPads and monitoring our health, keeping the people not in the hospital, decreasing the costs. Are you looking for these movements? Because it's going to happen very soon.
Yeah, well, Health Canada is. As CFO of the department, I was mindful about my own business practices within the department. We have a significant investment plan elsewhere that covers many aspects of the business. The Government of Canada right now is consolidating IT services as a shared service for all of the Government of Canada. So they're moving to the latest version of Windows, new tool sets and whatnot. It's taking a bit more time to get it right, but and we're now in departments looking at business applications to line up with the new technologies. There's a need for us to get there quickly, or quicker in my mind. That's just me, but because we have a younger workforce coming through that says, well, I can use my iPad on this at home. How come I can't in the office? And moving from one job to the next, why does it take so much red tape to do? There are some issues that are diligently being worked on by other people, and as a user of those services, I hope that they come soon. And as a person that can lever them, as you've described, I think that's key. Even with my own financial system technology, we're now that we've got the basics working very well, we're looking at mobile technology to add on to it, so managers can approve transactions on the fly, not at their desktop, and things like that. So to make it easier, and also the development we did was totally vanilla. I don't know if you know the expression, that it can be transferred to any other federal government department. It doesn't have Health Canada word mark or names on it. It's translated, it's both languages, and it's completely portable to other departments. So others are now looking at it. So,
great, thank you. Jamie, thank you.